Hi, welcome back to part 2 of my healthcare trauma series. You know who I am, Dr. Monica Bartoli with Orion Family Health. I won't go over it all again. So this episode, I'm going to talk about patient healthcare trauma. So like I said in the first video, I'm not here to talk about malpractice or mistreatment or misdiagnosis per se. I'm here to talk about trauma as in the experiences that occur from a patient's perspective in healthcare that leads us to this disconnect that we're experiencing between doctors and patients. So I feel like I can speak about this for a couple of reasons. Number one, I have been a patient myself. So through this talk, I will use some examples that have happened to me personally as a patient, because I, as a patient, have dealt with some traumatic situations when it comes to the healthcare field, specifically doctors. But also, I hear so much from my patients, and I observe a lot of things that patients say. And that's what really prompted me to make this series, because recently, as I've launched my own practice and have talked to people, I hear them say things, not to toot my own horn, but they thank me for things that I just think should be normal. Or they feel like they're a bother for things that are really no big deal. So it got me thinking, somebody made them feel this way. Some prior experience with a physician made them feel like this. So I made a list of things that to me are apparent examples of how patients experience trauma with healthcare and trauma with physicians. And maybe some of these will resonate with you, or maybe they'll make you realize, gosh, I didn't think that was a big deal, but wow, it is. And hopefully give some insight to physicians who maybe don't have enough time to sit down and talk with patients about their experiences one-on-one. You know, we all read our reviews and it warms our heart when we get good ones, and it frustrates us when we don't get good ones. But actually having conversations with people and listening to them has given me so much insight into what is going on. So the first thing I'm going to tell you is I see a lot on the internet, specifically social media, of people posting in forums, whether they're local neighborhood groups or city groups or whatever, looking for a good doctor. Can someone give me a good doctor? And it could be variable specialties or, requirements of what they're looking for, but they always use the word good. And it got me thinking to myself, well, what's a good doctor? How do you define a good doctor? And that, I think, is different for everyone. I think for some people, it's someone who writes what they want, orders what they want, just does everything they want. For some people, it's somebody who listens to them and who treats them as an equal in their care and has educated conversations with them. For some people who may not have so much health literacy or background in health or science or know much about medical things, it may be a doctor that tells them what to do. So everyone's definition of good doctor can vary based on what they're looking for and how they see their care. So I always respond to those groups, and I don't do it to self-promote. I have quite enough business with my marketing that I do and with my word of mouth with my patients, but I do it to help, because when they say I'm looking for a good doctor, well, I'm a good doctor by my standards, and people don't know I exist if I don't tell them that I exist. So, but I just find it interesting that they use that term over and over. And I don't know what the right answer is, but what's a good doctor? I think that's different for everyone. So trauma in the healthcare field, specifically with doctors, can happen for patients as a child. Some people have these experiences where, the most common thing I see as a doctor is a tummy ache. My stomach hurts. And as doctors who take care of children, pediatricians, family practice doctors, the abdominal pain complaint can be 100 different things. And a lot of times, thankfully, it's not a big deal, but it often gets dismissed, I find. And it ends up where, the pediatrician or the family practice doctor says, it's nothing, you're fine. And that starts to give feedback to the kid that I feel something, I think something's wrong, but they're telling me nothing's wrong. And it can be confusing. So some trauma can start from, being a child and being taken to the doctor and told that you're fine when you're obviously not. Also, the idea of only going to the doctor when you're sick, starts to create a little bit of trauma that I don't need to go when I'm healthy because they're just going to tell me I'm fine, which is not true. All right. As we get older, we recommend preventative visits so we can make sure that you continue to be fine. But it starts to put those ideas in a child's head that the only time you go to the doctor is when you're sick. And when I feel this, I might as well not even go because I'm told I'm fine. So we start to dismiss pediatric patients at an early age. One common theme I have seen since I started my new practice is patients feel like they're an inconvenience to me. And it breaks my heart. It really does. So those of you who are not part of my practice may not know. So I book my appointments for an hour, okay? Whether it's a simple UTI or we have to go over 10,000 medicines or it's a physical, everybody gets an hour because what starts as a simple visit, sometimes somebody will bring something else up or we go down a different road that we need to address. And I have had patients apologize to me for taking up their time or for them taking up my time. And I think to myself, where did this come from? In the past, has a doctor told you, I don't have time for this? If you looked at my last video, you'll know that yes, that happens quite a bit because our appointment slots have been, narrowed down to 15, 20-minute appointments. And I have said it myself that I don't have enough time in this visit to go over all that. What's most important? Were you late to an appointment before and the staff or the doctor themselves said to you, well, you were late, so you only have X amount of time to talk to the doctor, and making you feel like you're taking up their time? I just, it really strikes me when people say that. I've also been in places where patients would call to ask a question, right? Oh, just a quick question about the medicine or what the doctor said. I'd like to leave a message for the doctor, and the doctor doesn't call you back. The nurse or the MA or the assistant does, but the doctor doesn't. And that can make patients feel like we're too busy for your question, And so it's just amazing to me. I had recently some patients tell me, I'm sorry for taking up your time. If you don't have time to talk about this, that's okay. We can do it later. Or I'm sorry for making you drive out here. I'm a house call doctor and I take care of patients across 2 counties. And I also have some patients who are a little further than my geographical area. I know what I'm getting into when I book their appointments and they tell me they live an hour away. This is what I do. So I hear patients apologize to me. And that comes from some traumatic experience with doctors making them feel like they're an inconvenience or they're a lot of work or they just don't have the time to deal with patients. So if you're a patient, you've ever felt like that, I'm sorry. If I've ever made you feel that way, I'm sorry. But that's one example. Another example of patient trauma is not feeling validated with your doctor. I have patients come in with sometimes very odd symptoms, and sometimes we can't figure out what it is. And I always approach people and say, well, I don't know if I can tell you what it is, but I can tell you what it's not. And I can hopefully tell you that whatever it is not going to kill you. And as long as it's not going to kill you, and as long as you're not going to suffer, then it's probably okay. But sometimes a workup is normal, and I've heard this from other doctors, other patients, and might have done it myself in the past, where something's normal and we look at a patient, we say, you're fine, there's nothing wrong with you, but there's something wrong, something's off, and you don't feel validated in that. You get dismissed, and doctors say to you, well, it's no big deal, figure it out. And that's not how it should be. We can't always figure things out. We're not God, and we don't know everything about science and medicine. But what we can do is reassure patients that you're not going to die. It's not life-threatening, but it is uncomfortable for you, and I recognize that. Perhaps we should try these different avenues. So not feeling validated, and that creates trauma. And then what happens is the next time you go to the doctor, you don't even want to hear what they have to say because you know already they're not going to tell you what's wrong with you and they're going to dismiss you. And so that creates that wall and that barrier. Another traumatic experience for patients that I've come across are patients feeling like they can't access good care, new care, quality, anything, if they don't have the money, if they're not super rich. This is disgusting in this country, how medical care can bankrupt people. And whether they've experienced it themselves, that they, have gone to the hospital and gotten a bill for $200,000, or they know somebody who has, or they've even seen it on TV. It creates this trauma and this fear-based experience that I'm going to go to the doctor, they're going to recommend all these tests, or they're going to recommend this medicine, or they're going to recommend I do something, and I can't afford it. And your ability to pay for medicine and care is not a value of your worth as a patient. So one example that I've heard is patients being written prescriptions for medicines, brand name, brand new, excellent medicine. And then they get to the pharmacy and the pharmacist says it's $400. And then the patient says, well, I can't afford that. And the pharmacist says, okay, well, I can't fill it for you. That's awful. So I can understand how that is traumatizing for people. There are so many ways to save money in healthcare, and doctors and healthcare professionals do not do a good job of helping their patients find resources. That's one of the big things I'm big on is quality healthcare. So I take the time to find them for my patients. But I've had patients say, I can never afford anything outside of my insurance network. I can never afford anything outside of my insurance coverage, or my insurance doesn't cover anything. And that is not true. Again, I'm not looking to self-promote myself in these talks, but my practice membership is $100 a month. And that includes everything that I do, everything. Urine tests, EKG, in-home visits, pick up my phone, answer you, advocate for you. It's not that expensive. For some people it is, and I understand not everybody can spare $100 a month, but we try to keep it reasonable because I don't want patients to feel like they have to be millionaires to have that kind of care, because they don't. I'll tell you an example of when I have been traumatized like this as a patient. I went to the emergency room. I have had a vague condition that puts me in severe pain. I end up going to the emergency room mostly for pain control. And I said to the doctor, I do not have health insurance. I'm a physician myself. I know that you have a workup that you need to do to feel comfortable to treat me and give me medicine, and I respect that. I ask that you only do the bare minimum of what you really need to do because I don't have insurance. And he said, no problem. I'm just going to run these 2 tests. I gotcha. Don't worry. And guess what? At the end of the visit, I had, he had ran almost every test under the sun. I had a $7,000 bill, even though I specifically requested that he be conservative because I don't have that kind of money just laying around. So that is very traumatizing and sticks with you. I feel sometimes now when I go to the ER that they're not going to listen to me, no matter what I say. And the last thing is, I find that patients have been made to feel bad for asking questions, and that's super traumatizing. I found this because I had a patient recently who, just to keep it very general, takes a certain medication very sparingly, and they told me in their own words, you're the first doctor that didn't make me feel like a drug addict. And I just looked at them and said, what does that mean? So this person was very much made to feel like less than or feel bad for her request when she knows what works for her, that she takes a certain medicine every so often, extremely sparingly. We can monitor this through refills, and it was made to feel like a drug addict or drug seeker, or like she was ridiculous for her request. And I'm sorry that happened. I didn't make her feel that way, but somebody else did. And so that's real. Patients get traumatized when they ask for questions or maybe suggest a treatment themselves they heard about, and they genuinely want to feel better. And some physicians will turn around and make you feel bad about wanting to be a partner in your care or knowing what you would like to do and questioning them if that's an option. So I hope that some of these examples of trauma resonate with you, or at least make you understand that doctors do recognize that patients are being traumatized as well. And like I said in my last video, I do think that doctor trauma bleeds into this patient experience and then creates patient trauma. And then we just continue to hurt each other, right? So you have a patient who's already frustrated and they go into a visit saying no doctor's ever listened, no doctor's ever cared, this doctor's not any different, and they have their guard up. And then the doctor comes into that visit, right? And they go, ugh, this person's seen 5 doctors in 5 years, takes 20,000 medicines, is 5 minutes late, and I have 10 more minutes left with them. And we meet so disgruntled and disjointed that we get nowhere. So my last video on this series is coming soon, where I talk about kind of bringing this all together, concluding it, reviewing some of the cause and effect traumas that I talked about, and more importantly, my solution to fixing it, and some ideas of how we as patient and doctor can come back together and be a partnership again, and take care of each other. I always tell my patients, I don't just heal them, they heal me. When I leave an appointment and go, oh, I did something for that person, we're getting better, they're getting better, I get better. So I hope we can help each other heal, and kind of restore that sacred bond that's supposed to be between patient and physician. So make sure you hit subscribe and follow along for part 3. Thank you.